Thanks very, very much. It has been very interesting listening to the different members that we've been speaking to, the registrars and the CEOs that have come in from the different medical councils. So we've heard from Kenya, we've heard from Ghana, obviously from South Africa as well. And now we get the opportunity to chat to the Zimbabwean representative. And the person that is here from the Registrar of Medical and Dental Practitioners Council of Zimbabwe is Josephine Mwakutuya, and she's going to talk to us obviously about Zimbabwe's involvement in all of this and being a part of AMCOA and what it does for the country and for the members of this the particular registrar and the union there. Great to have you. Thanks very much for joining us.
Thank you, and thank you for having me.
So, coming together, talking as a continent and different registrars that obviously you're representing your country to come in and talk about best practice and what it is that you go through as a country in the medical field. What is it that you as Zimbabwe will be bringing to the table when it comes to being a member of AMCOA?
Thank you very much for that question. Firstly, I would like to say just a little introduction. As you know, AMCOA is there to promote best practice, and it has been there for the past 24 years. And as countries, we come with our experiences, right? Zimbabwean experience, Kenyan experience as registrars and boards. Then we speak on those experiences, and then from those experiences, policy are then evolved. So from AMCOA, as you know, the functions of councils, of medical regulatory authorities, is basically registration, education, and fitness to practice. Registration, of course, to ensure quality care. Quality care, right? Registration to ensure that the doctors that you are registering are qualified. I'm sure that has been sung by my colleagues. So in that, as AMCOA, as you might want to know, we now have a lot of trainees, medical trainees, dental trainees, nurses, pharmacists, trained from outside our borders, right? In the Eastern Bloc, China, Russia, Ukraine, Cyprus, UK, everywhere. And as AMCOA, one of the first lessons that we've learned is to have a policy, a sub-African policy. Actually starts from SADC, then AMCOA, a policy on how to deal with these foreign-trained interns, foreign-trained doctors to ensure quality, right? And AMCOA has come up with a policy on examination, where we do run examinations, and our country has also been involved. I think it was the second country in AMCOA to be involved in the registration examination. We do carry out registration examination of all the interns foreign trained, so as to ensure quality. So that's one lesson that we got from AMCOA as a country. And the other lesson that we got is about what we call source verification. As you know, and let me say that examination is also held to even candidates who want to come to Zimbabwe, who practice from South Africa, who trained in this, anybody who did not train in a prescribed qualification right at the University of Zimbabwe, they are subjected to this examination. We got that policy from AMCOA. South Africa does it, Kenya does it, to everybody who's not trained in their country. And for also to ensure that they've really went to medical school, we ask what we call a source verification. A source verification. We want a verification from where you trained, and we got that from AMCOA. Yeah. So it has been very helpful in that regard. And I tell you, we have ruled out some people who have not trained, who have not been near a medical school. Yeah, but because there's a way of verifying, which we use as AMCOA, as a region. So that's one lesson which we use on terms of registration. Then I'll come to education. Education, that's one part of the regulatory authorities. We got accreditation. As you know, all training institutions have to be accredited. South Africa does it, Zimbabwe does it, and we have a policy in AMCOA for accreditation, getting somebody from outside the country, outside the borders, to be part of the accreditation committee to see whether the training is acceptable, is safe training. So we were using Zambia. We had a Professor Banda from Zambia who was a member of our accreditation team. We got that from AMCOA.
So I want to, which is amazing. I mean, these lessons and policies are great, and this is what affects. But the reality is that let's look at what's happening on the ground, because, Doctor, one of the big complaints, and I talk about this. Yes, of course, you've got doctors that are practicing all over the place, and one of the big concerns that I've heard from your colleagues is the brain drain, is the doctors leaving respective countries and the shortage of doctors. Now, we find that a lot of Zimbabwean nationals will cross the border to come into South Africa to get medical care because they cannot find good medical care in Zimbabwe. Now, this is a worry because then it puts strain on South Africa's medical health care, whereas they should be seeking that medical care in their own home country of Zimbabwe. What do you say for something like that? Because that obviously is one of the issues that has to come up, that certain countries have to carry the load for other countries.
I'm sorry, that question, I'm not able to answer that. That's a political question that you're asking, but I can answer partly.
Good, please
what
do.
I can answer is, as you know, health, I'm sure South Africa and also Zimbabwe, we do have policies. Doctors are doctors. You can even treat prisoners. You can even treat anybody.
Yeah.
You can't shun away a patient. That I can say. Yeah? You can't shun away a patient.
No, you
when
can't.
When you're a doctor, you've got ethics.
Absolutely,
and we understand
that.
The other part is the political, which I cannot answer.
Yeah.
But what I can answer about brain drain, it doesn't mean that all the doctors are coming to South Africa. No, they are not, because at SADC, there is a protocol at SADC where doctors from the region who train in the region, they're supposed to go back to their countries. And Zimbabwe is part of it, Namibia is part of it, because everybody is facing brain drain. I'm sure you heard it from the Prime Minister yesterday, the Minister of Health of South Africa. He also spoke about brain drain. So we as a region, that's something we need to come up with a policy on migration of doctors. Because what is now happening is a doctor can just go probably to another doctor, get a testimonial, and then come to South Africa. I'm not saying they come to South Africa, or move to a regional border. As AMCOA looking forward, because we really need this health workforce. We really need them. South Africa does need this health workforce. We also need our health workforce. So what we would need there is to have a policy on migration. What I mean is, we need to have a regulatory body. If you see a Zimbabwean, just like what UK does. In UK, they have that principle. If a doctor is going to UK from Zimbabwe, I will send a certificate of good standing to UK, right, to say the doctor is in good standing. So that's what we are looking at. So as a region, we need those policies. Yeah. And again, on migration, we want to have government oversight on regulatory bodies. We really need to change the way we regulate so as to ensure, because I'm now talking of scaling up. We need to have a multi-regulational approach, right, with government oversight. Because, regulators are not isolated. They are part of government. I'm sure you know
Absolutely that. They are. And I understand this, but surely this has to come under discussion in a forum like this. And I'm not saying that your doctors are coming to South Africa. They're not. I mean, yes, you will get some that will come to South Africa, but they're not all here because the capacity is just too much. There are far too many people coming in seeking medical care. And I'm just giving you the South African Zimbabwe example. This can happen all over. And this puts pressure on the doctors. This puts pressure on the councils. That, of course, you will get a lot of people that will file complaints against doctors because they cannot handle the capacity of the amount of patients that are seeking medical care. So surely this does come up. I know you don't want to get into politics, but the reality is this must be an issue facing doctors right now, that they cannot handle the capacity. They can't handle their own country, never mind other countries coming to seek medical other country citizens coming in to seek medical care.
I don't understand that question, because if these are the people from around Messina, people in Harare don't travel to South Africa to seek medical care. They don't.
Yeah, they do. Don't. They do. Do you not know that?
We are not aware of that, because we do have hospitals in Zimbabwe.
I think if you can bring up these kind of conversations, I think it would make for a very good conversation of how, if you find that there isn't a good medical care system in one country, people flock to another country to get medical care. We need to have that discussion as well, that how you involve politics in medical care is vital. It's vital.
You know what? I'm saying this, we've got specialists. We do have specialists in our country. right?
Of course you
Yeah,
do.
we do have special. And
Yeah.
for your own information, our country has been the first one to separate me and what do you call it? Me and his twins. Those twins.
Yeah.
Those twins who were attached. Our country was the first one, but unfortunately, it was never publicized. We did it at Harare Hospital, Mr. Mbowaye Sango. Under that situation, we separated Siamese twins in Zimbabwe. We do have capacity. We do have. They were separated in that country. Unfortunately, that was never made public.
Yeah.
It
Well, you
was
should
never made
make
public.
these things public.
Yeah,
but I
we
think
separated twins. It was 2 years ago.
Yeah.
In Zimbabwe, we do have specialists, and some of our specialists were trained in UK. Even in Zimbabwe, we do have training programs. We've also amended our training program to meet the situation. So I fail to understand when you keep on zeroing that medical system.
because it is an issue. Because it is an issue. I don't know if you heard one of our one of our MECs talking out about the load that the Zimbabwean nationals are putting on the healthcare system. Did you hear that clip?
I noted it, but
Yeah.
I was a bit taken aback.
Indeed.
Because she,
How
as a
did that
doctor,
make you feel?
She, as a doctor, she said she would not treat a patient. And here we're talking about ethics.
Yeah.
I was a bit concerned about the ethical practice, because as a doctor, you're not supposed to be. You can even treat prisoners, and it's not only from Zimbabwe. They're also from Mozambique. I was taken aback. I was actually taken aback because as a professional, you're not supposed to discriminate patients. Are you supposed to discriminate? No, you are not supposed. That's a Hippocratic oath.
Yeah.
And these patients might be the ones around Beit Bridge, not from Harare, from blah. No. I definitely deny.
Do you now agree with me that it needs to be brought up as a matter of urgency? Because
What
even if it gets spoken at a level like that, surely it needs to be brought up here.
What I agree with you is that AMCOA should have a policy on migration.
There we go.
Yeah, it should have a policy on migration to sustain health workforce. That's what I agree with you.
Yeah.
We should have a policy. We should also have a policy going forward on changing the frameworks of regulation, right? So that we don't have what we call self-regulation to regulate the title, but to regulate the scope. Because we have to learn lessons from the pandemics that we have. Now we have a new pandemic of climate change. So we need to change the regulatory framework. You see, we need to change the regulatory framework, and we need to have a policy on migration. As I say, there are some other doctors who move out and say Zimbabwe is not issuing certificate of goods, and we are issuing. We are issuing doctors who want to go out. We are, but we are issuing those who deserve to be issued, because in terms of our core protocols, we don't want to export a problem. We don't want to export a problem. That's why I'm saying all regional bodies, regional MRIs in the region, we should know that if a doctor is coming from Swaziland, I'll give you an example. One of our doctors just went to Lesotho, and little did they know that he was a patient. He didn't have any certificate of good standing. So it is important that going forward, as a regional body, we need to have a policy on migration.
All right. I'm glad that'll be on the agenda. Thank you for talking to us. I've got to wrap. I've got to go to an ad break. Thank you for talking to us, and thank you for indulging me in these questions, because they're very important. Josephine Mwakutuya. Thank you for talking to us. Registrar of Medical and Dental Practitioners of the Council of Zimbabwe.